every day. Oh, in the city of the Zuma, for every man and woman, nation's capital. So we're standing tall. It's the city of the Zuma, for Pupa and Numa, nation's capital. So we're standing tall. There is freedom, no segregation. Welcome to the city of my president.
Hello, good morning. Merry Christmas in advance to all our esteemed viewers. You're watching Dateline Abuja on AIT. I'm Hawa Momo. In a bid to reduce stress, build self-esteem, the desire to be sociable, drug availability, unemployment, peer pressure, and socio-economic frustration, amongst others, is a factor that drives youths to engage in illicit drugs. The Federal Capital Territory Administration, FCTA, and the Drug Abuse Control Committee, DACC, has called on youths to stay away from drug abuse, drug trafficking, and all related undesirable acts. Today we'll be talking to NDLEA Commander FCT on sensitization of drug abuse. Well, my guest today on Dateline Abuja discussing substance abuse is Alhaji Amisu Lawal, is the NDLEA Commander FCT. Thank you so much for being part of Dateline Abuja, and compliments of the season to you.
Same to you, and thank you for having me.
Okay, first of all, let's define substance abuse for those who don't know what substance abuse means.
Well, the term as it were has a varied definition. It depends from which angle you are coming from. But I think to a layman is any substance taken that is intended to change behavior or to change the body physique. And again, we can as well say any drugs this time around that is taken outside medical prescription.
So we're all guilty of that?
That could be drug abuse, yes.
Okay.
It is. And that's why quite a number of people unconsciously and perhaps unintentionally are victim of drug abuse. That's why at times for a drug abuse patient, this time around, I'm not saying criminal, patient, it appears he really needed some level of help.
Okay.
Because like you said, we're guilty of it all.
Yes, we are. Okay, so what are the causes of drug abuse?
Now, taking out the generic definition of drug abuse, coming back to the one that is potentially dangerous to us, is a number of issues ranging from physiological, that has to do with the body chemistry. You started by saying that you wanted to use it first for medicinal purposes. Somehow, because you decided to be creative by yourself, that is medicinal. But unfortunately, you don't know at what stage that you draw the line. You get some of the drugs have some addictive tendencies, and the feeling you derived yesterday, you wanted to achieve the same feeling tomorrow, today, and the day after. So gradually, you derail into drug abuse. And coming back to the medicinal definition again, most of us these days, you walk into a medicine store and decide to say that I have headache, or right in your room, you decide to say that I have some painkillers. It could be paracetamol. You never can tell. It can be as well aspirin or anything. Then before you know it, you take it at will, believing that it will remedy the crisis situation you feel in your physical body. So that's drug abuse. But the other sociological issue, which is more potentially dangerous, like I said, it has to do with what happened with our adolescents and perhaps the misguided youth and even the grown-up adults, where you take drugs with the intention to change your psychological being, to feel high. Because I think that's the most potential, that's the one that is potentially dangerous.
High or low?
Yeah, whichever way, it depends on your body's psyche and what is the intention for it. Some will want it to be low, some will be wanting it to be high. And again, the drugs itself will give you that desired effect you wanted. For that, One, there is peer group pressure. Advice, or you don't have good companies, you tend to pick up the wrong ideas. That's why we always advise for the parents to start it early, because if you don't educate your child, someone else is outside to do that.
Yeah.
And you can as well be assured that no matter what you are doing, as a child is growing up, potentially approaching 13, 14, you are throwing him to the world. So what you should have done earlier is proper guidance. But where that fails, the tendency is he's likely going to join the bandwagon. And then that's too bad. That's the peer group. And again, related to that is the home issue, where back home, every child, his mentor is his parents. Those who are his role model are his parents. If, unfortunately, one thing or the other derail the family status, then, and he tend to see in the parents as being good behavior, a father coming drunkard or a mother taking pills, so sadly he's going to copy from that, because these are his first role models. And then, again, closely to that, when you have such parents, the likelihood of having too much of parents but without parenting. Because most of the crises we have is that we pamper our children, we so much love them, we try to work for them, but unfortunately that's not parenting, because we are not really doing what they are supposed to learn, to at least mold them for a larger society, not to the family. So I think, in a nutshell, these are some of the crisis situations that lead to drug abuse. But there is another one, the issue of chaotic distribution of drugs. Certainly, there wouldn't have been drug abuse without availability.
Yes.
But the public health sector have a role to play in that. Because if the public health sector is quite active and strong enough, there wouldn't have been proliferation of unwholesome sales of drugs all over Nigeria. I think that's the crisis.
Okay, we're coming to the FCT now. We know this is a major problem. And as a matter of fact, in the north, it's actually very high, the rate of substance abuse. But let's come to the FCT. How are we sensitizing people? I know sometime last month, the NDLEA did a 24-hour surveillance in the FCT to sensitize people and to also, clean up. How successful was that?
It is quite a good initiative. It was muted by the National Drug Law Enforcement Agency and wholly and solely financed and supported by the Honorable Minister of FCT. And I think it was quite a very nice and effective way of disrupting the process of drug abuse in the FCT. It was selected kind of a pilot program that ran for about 3 months. It rounded up sometimes by mid-November or thereabout. Hopefully we're trying to reenact this time around, re-strategizing further, because we've really noticed the gains. Some of the challenges noted in that, we're trying to work out modalities that we extend the process. I think that's quite effective. And for the public enlightenment, just last weekend, Saturday, we had a public enlightenment and engagement forum with communities in Wuse Zone 4. The intention is that they really need to have the buy-in of the fight against drug abuse, because these criminals are not really from the heaven, they are just within us. So effective policing alone will require partnership. You need to partner with people, people need to come forward, people need to identify some, because in some cases these are people that mix, and in some cases even transmute themselves as if they are normal citizens and normal business partners within the neighborhood. So I think partnership and engagement like that took place over the weekend. I think that's the way to go, and I think we want to encourage other communities and neighborhood, especially the Barnes area as well, to emulate something like that was done with the Season 4. Okay,
so why the increase of, because we don't know where it came from, why the increase of substance abuse in the FCT? Where are they coming from? Last year I did a story on drug abuse. I went to Area 1, I went to Zone 4, I went to Banex, where they sell the drugs. Actually met with the support of NDLEA, and I went to these people, and some of them said to me, you have to pay, you have to buy me drugs before I talk to you, you know? And you see them selling it, daytime, we did this story for 3 days. During the day, we're going there and we're selling the drug, like they were selling meats, openly. So what is the FCT and what is the NDLEA doing, minus just sensitizing this, minus this your sensitizing programs once in a while? I'm sure there was strict, other stiffer measures that you have to take towards curbing drug abuse or substance abuse in the FCT.
Yeah, if viewers are listening very careful, we talk about the exercise that was done some 2-3 months back. Already those areas you mentioned, they've been mapped out, they've been identified, and of course what we intend to do is we don't really wanted to let the cat out of the bag. So otherwise I would have, but like I said, a lot of strategy is in place and we're really going to roll out. And even before you mentioned some of those places, part of the brief I had, and which I equally know, having stayed in FCT for a while, that we need to do something, especially in the city center. But slightly coming back to what you said, what could have accounted for this? The larger percentage of the people you see milling around, banners, whoosers on 4, and perhaps the entire cannot crescent. Yeah, they are not really staying in FCT.
Really?
Yeah, the crisis we are facing is that it's just what we are paying for urbanization. Some of these guys are coming from the contiguous localities of FCT, places like the neighboring communities between Niger and FCT, between Nasarawa and FCT.
Are they bringing the drugs along with them?
Yes, because what will happen is that when we have an operation like you said, you ended up seeing, you arrested somebody with 2, 3, 4 bottles of codeine, and the source is like an itinerant seller. Somebody will just come, he will be driving in a taxi with a stop in, only for him, perhaps the GSM too, technology now, many people will take advantage to it, even if it means criminal. What they do is, when you communicated, they slow down just by way of flash, pay the money and pick up and move. So you hardly see them staying in a place. But I think that's okay, we've already noticed that and we'll have to work around that.
So in the FCT, can you differentiate the kind of drugs that we have, apart from the cannabis that is rampant?
Well, cannabis has been the lead. It has been in the lead, maybe because of the cost implication, because it's the one that is being cultivated in Nigeria, and largely because it was the one in the illicit domain, that's the illegal domain, that is pretty early, much more than cocaine and heroin, because they are in the same category.
Are they?
Yeah, they are, cannabis. Now, but the problem now we are having in FCT and to a larger percentage in almost the whole of northern Nigeria is the issue of psychotropic substances. Tramadol, for instance, that ordinarily would have been painkiller.
But that was banned.
Yeah, it's banned because of the abuse nature of the drugs, but it's not really banned because it's medicine of requirements.
Yes.
Yeah. So what we did, what actually happened, it was a policy statement. It's not the law. What it means is that the process of acquiring tramadol, it wasn't as it used to be then, where you need to just have it anywhere. What it means is that tramadol must be prescribed by a physician, and is now a prescription drugs. And again, most of the tramadol you're seeing in the street is far above the threshold of what a normal physician would have recommended for you.
Okay.
Ordinarily, what you have is 50 milligram, 100 milligram at worst. Then, in worst case scenario, maybe add up by the physician. But what you have in a single dose is 225 milligram.
The ones they sell on the street.
The one that you see them hawking around. Why they had to be selling those things is tramadol is an opiates. Opiates, that is the major ingredient or plant of heroin. So, and that is the addictive tendency. So by adding more of the addictive ingredients, making it 225, the potential of you getting high and getting it as you wanted is there. So people keep on hooking onto that tramadol. Then outside that we have the benzodiazepines. You call it's Roach. Roach is a company,
okay,
but that's not the name of the drug.
Okay.
It's a company. But unfortunately for the company, because that was what really brought it out, the drug's name is Refinol.
Refinol.
Yes. The most popular one is the one being produced by Roche. Now, again, coming back to, as a law enforcement officer,
that's the most popular one on the streets, the Refinol.
That's why I say, as a law enforcement officer, again, I would rather advise that the company, Roche itself, need to look inward and see what is actually wrong. How is this thing getting out to unauthorized persons? Because it's a benzodiazepine, it's just like Valium, which is like they are supposed to be a prescription drugs. But why is it that it's readily available? But it's medicine as well. Because ordinarily, you're saying, like I gave you an instance of the flash method of delivery. All you need to do now with the advent of technology is to make a call. For the drug user, you always try as much as possible and see how you can minimize the risk. How you can potentially, for the seller, potentiate his profit. So the best way you can do it, leverage on technology, leverage on the transport system, make a quick dash for the business and see that he tries as much as possible and evade law enforcement. But I think we are getting to know all these things. It's just that it's unfortunate at times, it's always one ahead of us.
Okay, let's talk about rehabilitation centers in the FCT. I know this is another major program. I've also done a story last year. I've also talked about rehabilitation centers. We know that we have few psychiatric hospitals, but what is the NDLEA trying to do to rehabilitate people? Now we're talking about just touts. We know that there are also children from very rich homes who are stuck on these drugs. So it's not only something to be that we say it's just for touts. These drugs is actually affecting everyone.
Thank you very much, Hawa. See, I was following the trends last month or so, where a number of rehab in quote centers were closed down because they were actually not rehab centers.
Okay.
Those, if you could recall, there was widespread massive raid by law enforcement and government across the north and almost the entire federation, where supposedly rehabilitation center, they call it torture center because it wasn't really a rehabilitation center, being an informal sector where quite a number of people were rescued by law enforcement and state officials. Now, that is to tell you and to give you an insight into the enormity of the crisis. But unfortunately, when those centers were closed, there appeared to be no readily reception or a kind of a transition.
For the patient.
Because they are patient.
Yes.
They have one concern or the other for being there. So what we could have done is that it was because of the gaps in our public health system and intervention strategy that caused the springing up of those torture centers. Now, what we could have done as well, we should have a standby, an intervention policy that would have absorbed these people. Because I can tell you some of the parents are quite sad, damning the consequences of the potential liberty and freedom of those people that are there, because they really don't know what to do with the children.
Yes.
Glad, as it were, the Honorable Minister of FCT, in one of his interactions, I had looking at the issue of rehabilitation center and seeing that the FCT is really going to see what needs to be done. But you see, coming back to the rehabilitation center, by the National Drug Control Master Plan, there were quite a lot of responsibility assigned to different segments of government agencies. The Federal Ministry of Health, they were tasked with some level of intervention in terms of the therapeutic medicine. People that are into drug abuse but require medicinal intervention.
Okay.
This way, they are supposed to, those categories are supposed to be handled by Federal Ministry of Health. Yeah. But
sorry, is that true, like psychiatric hospitals?
Yeah, but it shouldn't be called and addressed as psychiatric hospital.
Okay.
Because when you address it as psychiatric hospital, you are talking of a very serious psycho case.
Okay.
But these are people that are into just drug abuse, and not even drug abuse, substance abuse for say. It could be that he is just taking alcohol and he just wanted an intervention, or he's just even the cigarette and he wanted an intervention. So he really wanted somebody that will help him out. And for NDLEA, we are the first responders that has to do with counseling session and assessing and see whether such case can still be handled by NDLEA or it can still be referred for medicinal intervention, that is therapeutic counseling.
Okay.
Yeah.
Okay, so you're saying this is what would have been done.
Yeah.
So what are we going to do now? You're saying what would have been done.
No, already.
What are we going to do now?
Already, that is why the National Drug Control Master Plan envisaged this, and that is what is in place. The last strategy elapsed 2019, and right now, as we're coming up with a new strategy. And of course, in the new strategy, all those things have been factored into. And I can assure you, hopefully, let's see what happens within the rolling year as it's coming. I'm sure the government is coming up with more rehab centers.
Okay, so rehab centers for the masses and also for private individuals. Is it going to be free?
Every responsible government try as much as possible and make public health issue a public priority.
Okay.
So I can assure you that that wouldn't have been an exception.
Okay. Okay, now let's talk about, I know that this has to do with the courts. You know, we talked about it off camera and earlier on. Well, are these strict measures, like, we know this, if there were stiffer measures or there were strict measures against drug abuse or the people who sell them, because you can't just go somewhere and you know that, for example, you call bandits. So everybody knows that if you just go somewhere in bandits, or at night, all those young boys hawking cigarettes, they also sell drugs. If there are stiffer measures to remove them or to cut them out of society, what is NDLEA doing about them? I know if it's for the court, but I'm sure there's something they're also doing.
NDLEA are still supposed to be the enforcer of the law.
Good.
The court is to adjudicate now. But where the problem is we try as much as we could to separate the victim and the criminal.
Okay. So who's the victim, the buyer?
The drug abuser is a victim.
Okay.
Yeah. So we try as much as possible not to criminalize the victim. Now, but in between now, there is a thin line. Because when you have somebody with just one rap and is in his own testimony that he is a user, you'll be faced with a challenge. And then if you conduct a check on him, he is truly a user. Now, but for the dealer, this is a straight jacket issue. Pick him up, charge him to court, and get the maximum as it deserved and provided for by the law.
Okay, so how successful has that been? Because we're still seeing them all over.
They are springing up, like I said, and then unfortunately, a number of interwoven factors keep on attracting more and more people. They could not be the same people that you're seeing. There could be.
Or you think it's a very strong cabal, like, you know, like the Italian mafia? We can't really know the major source, because there is a major source, or there are major sources.
We've not gotten to the issue of the mafia, but certainly if nothing is done, we can get to that level. Because what happens is that if there is an attraction, somebody somewhere.
Of course.
I don't know whether you actually watch the BBC show where they call Sweet Codeine.
Yes.
Yeah. In between it's quite a masterpiece research work. They were able to trace the source to a particular company. And I think that's the way, that's a stepping stone. We'll push further with that.
Yeah, like you said, the Raffinol, you know, you said that we don't know it's supposed to be a drug, one pill, but now they're popping it. So meaning that we need to deal with the company.
Yeah, like I said, it might not necessarily be the company, it's a chaotic way of distribution. Yes. We kept on calling on the Pharmaceutical Council of Nigeria to do more. because no drugs leave any factory without a pharmacist signing for it. Yes. So, sadly, they need to do more because they actually purchase it either by way of wholesale or whatever, because they have the authority to manufacture this, they have the authority to dispense this. So, but somewhere along the line is the chain of distribution that is chaotic in Nigeria. And nowhere in the world that you have such a chaotic nature of it.
So what is NDLEA doing about it?
Of course, it's not an NDLEA issue alone.
Okay.
It's kind of a multi-sectoral issue involving the Federal Ministry of Health, involving the experts too. That's the Pharmaceutical Council, NAFDAC again as well. They're part of it. So I think we're engaging, and I think at the end of it all, everybody will smile. Because for the government, medicine has to be made available and affordable.
And you also say you will have more sensitizing programs during the coming year?
It's an ongoing project.
Okay.
So, and I think it's one of our prime responsibility to conduct public enlightenment on issues of drug abuse.
Okay. Thank you so much for being part of Dateline Abuja. Well, I've been talking to Alhaji Amisu Lawal, is the Commander NDLEA FCT. This is Dateline Abuja. Stay tuned. I'll be right back. Guardians and parents, government, religious leaders should not get tired of sensitizing people on the dangers of drug abuse. Let it be known that the abuse of substances doesn't just affect the victims, but also affects the individuals and the society at large. Just a reminder to everyone, just as the festive period is approaching, Nigerians around the country are finalizing travel plans for the season. The long distances traveled at this time, layered with large number of vehicles on the highway, can easily result in accidents caused by fatigue, distractions, overspeeding, faulty cars, etc. So extra precaution needs to be taken. Please drive safe to stay safe. And that's all we have for today on Dateline Abuja. Don't forget to follow us on any of our social media handles showing right now on your TV screen. Keep a date with me, same time, same station, for a special Christmas package. I'm Hawa Momo. Bye for now.